Heart health and blood pressure. Gentle exercises to prevent stroke and heart problems. Every 34 seconds, someone in the United States dies from heart disease, but the good news is many of these problems are preventable. Hi everyone, and welcome back to the channel. Today we're diving into heart health and blood pressure, and I'll show you gentle, simple exercises that can help prevent stroke and heart problems without needing a gym or heavy workouts. These movements are backed by medical research, easy to follow, and safe for almost everyone, even beginners. So grab a chair, some space to move, and let's protect your heart together. Gentle exercises to prevent stroke and heart problems. And if you care about your heart, make sure to subscribe. You'll get more science-based tips for a longer, stronger, healthier life. Hello everyone. Welcome back to the channel, and today we're talking about something extremely important: heart health and blood pressure, and how simple, gentle exercises can help prevent stroke and heart problems. If you care about your heart, or someone you love's heart, this video is for you. Why this topic matters: high blood pressure, hypertension, is often called the silent killer. It places enormous stress on the arteries and the heart, increasing risk of heart attack, heart failure, and stroke. According to the American Heart Association, regular physical activity helps you manage blood pressure, strengthen the heart, and reduce cardiovascular risk. European Society of Cardiology, www.heart.org, Hopkins Medicine. Also, research shows that in people with high blood pressure, walking further and faster was linked to a 24% reduction in stroke risk. European Society of Cardiology. And broader studies show that exercise is a key element in stroke prevention. PMC. So today, I'll guide you through some very gentle, accessible exercises you can do, and we'll discuss the medical evidence behind them, so you can protect your heart and your brain. Medical background. What happens in heart and blood vessels? To understand why exercise matters so much, let's briefly talk about what's going on in your body. When blood pressure is high, the force of blood pushing against arterial walls is elevated. Over time, this damages the vessels, makes them stiff and less flexible, and the heart has to work harder. This increases the risk of plaque buildup, artery narrowing, and ultimately heart attack or stroke. On the flip side, regular aerobic and physical activity improves vascular function. For example, it can reduce inflammation, improve blood flow, and reduce blood pressure. Hopkins Medicine. Moreover, for stroke prevention, studies indicate that people who engage in regular exercise have a significantly lower risk of first-time stroke. PMC. In short, exercise is part of the medicine we use to protect the heart and brain. Gentle exercise. For 1, brisk walking. First exercise, brisk walking. This is perhaps the simplest and most effective. As the study of over 36,000 people with high blood pressure found, every extra 1,000 steps a day was linked to a 17% reduction in major cardiovascular events and a 24% reduction in stroke risk. European Society of Cardiology. What you can do: aim for a pace where you're walking faster than your usual comfortable walk. You can still talk, but you feel your heart rate rise slightly. Start with 10 to 15 minutes, gradually increasing toward 30 minutes if you can, ideally 5 days a week. Gentle exercise number 2, seated or standing leg march. Low-impact aerobic moves. Second, for those who might have mobility issues or are just starting out, try seated or standing leg marches or low-impact aerobic moves. For example, march in place, lift knees gently, swing arms. Why this helps? Even low-impact movement increases circulation, gets the muscle pump going, which helps return blood to the heart, and gently elevates heart rate. Over time, that helps lower blood pressure and improves vascular health. Gentle exercise. Number 3, gentle resistance, body weight moves. Third, gentle resistance or body weight exercises. Think wall push-ups, chair squats, light lunges with support, or even standing calf raises. Why? Resistance activity helps build and maintain muscle, which supports overall metabolic health, including blood pressure control. Combining aerobic plus resistance is recommended for heart health. Hopkins Medicine. Keep it simple. Perhaps 1 to 2 sets of 8-12 reps each, focusing on slow, controlled movements. Fourth, flexibility and balance exercises. Gentle yoga, stretching, maybe Tai Chi. Why? These help reduce stress, improve vascular function, support balance, which lowers fall risk, and help overall cardiovascular system via relaxation and improved circulation. A supportive source, general exercise guidelines mention low-impact workouts like walking and yoga as reducing stroke risk. You might include 5 to 10 minutes at the end of your session for stretching, hamstrings, calves, chest, shoulders, and some balance moves. Single leg stand, heel to toe walk. Here's a sample weekly plan you can follow. Monday, 30 men brisk walk, plus 5 men stretch. Tuesday, seated leg marches, 15 men, plus 1 set bodyweight work, wall push-ups, chair squats. Wednesday, 30-minute walk, plus 5 men balance work. Thursday, gentle resistance workout, 2 sets, plus 5 min stretching. Friday, 30 min walk or low impact aerobic plus cooling stretch. Saturday, optional active recovery, light walk, gentle yoga. Sunday, rest or gentle movement, walking, stretching. Remember, consistency is far more important than intensity at the beginning. The goal is to build the habit, strengthen your heart gradually, and reduce blood pressure over time. Safety and tips. Some safety tips. Always check with your healthcare provider before starting a new exercise program, especially if you have heart disease, hypertension, or other conditions. Start slow. If you're new to exercise, even 5 to 10 minutes at a time is valuable. Monitor how you feel. If you experience chest pain, dizziness, unusual shortness of breath, stop and seek medical advice. Stay hydrated, wear comfortable shoes, pick safe surfaces. Use a blood pressure monitor if you have hypertension and track trends, not obsessively but regularly. Finally, set realistic, measurable goals. For instance, increase your steps by 500 per day each week. Evidence recap. Let's recap the evidence. Regular physical activity lowers blood pressure, strengthens the heart muscle, lowers inflammation, and improves circulation. Hopkins Medicine. In hypertensive populations, walking more and faster significantly reduces risk of stroke and cardiovascular events. European Society of Cardiology exercise is a proven part of stroke prevention strategies. PMC. Addressing common questions and barriers. Q1. I don't have time. Answer. Even shorter sessions help. Research shows that even modest increases in activity, for example walking more steps, reduce risk. European Society of Cardiology. You can break into 2 10-minute sessions if that fits better. Q2. I'm older, I have joint pain. Answer. That's okay. Choose low-impact options. Seated marches, pool walking, gentle yoga, support your body. The key is movement. Q3. Will exercise alone fix high blood pressure or heart risk? Answer. Exercise is one major component. You'll also want to follow healthy diet. For example, the DASH diet helps with blood pressure. Avoid smoking, moderate alcohol, manage stress and sleep. But exercise gives you a strong foundation. Q4. How soon will I see results? Answer. Some benefits, like mood, circulation. You may feel quickly. Blood pressure improvements may take weeks to months with consistency. Think long-term. I want to encourage you. You don't need fancy equipment, a gym membership, or to become an athlete. Simple, consistent movement is powerful. Imagine you doing a brisk 15-minute walk today, then the next day adding a 5-minute chair squat session. And by week 4, you feel stronger, less winded, Maybe your blood pressure is a little lower. That's progress. And every time you move, you're giving your heart and your brain a gift. Less risk of stroke, fewer complications if you do have high blood pressure, more resilience as you age. Finally, wake up each day with the mindset, how can I move a little more than yesterday? And follow through. Over time, that adds up. You've just taken an important step to protect your heart and your life. Remember, every small movement matters. Stay consistent, be kind to your body, and your heart will thank you every single day. If this video helped you, please give it a like, share it with someone you care about, and don't forget to subscribe for more gentle, science-based tips to keep your heart strong and healthy. I'll see you in the next video, where we'll explore more ways to boost your energy and protect your health naturally. Take care and keep your heart happy. If you found this video helpful, please hit the like button, share with a friend or family member who might benefit, and subscribe to the channel for more heart health and wellness tips. Also, comment below, what gentle exercise will you commit to this week? Let me know and I'll cheer you on. Remember, your heart is worth the time and effort. This video is educational and not medical advice. Talk to your clinician before making changes, especially if you have chronic conditions or take prescription medications. Thank you for watching. Stay safe, stay active, and take care of your heart. Until next time, goodbye. Stay happy and healthy life after 50.